It's time for the Dr. Cho Show, the show that helps you understand the latest and safest modern dental techniques for you and your family. You'll become an educated dental consumer and also learn about health trends outside of the dental industry. Here's your host, Dr. Dan Cho.
Hello everybody, welcome back to the Dr. Cho Show, your number one resource for everything related to your oral health. And what we're going to be talking about today has a little bit of relevance. I don't know if many of you have noticed, if you have young children, you might not, but recently there's been a shortage of formula. And I know this because my wife and I, we have a baby, a 5-month-old, and yeah, it's a little bit kind of unsettling to know that there's kind of a fairly large shortage of formula, and so I wanted to take a little bit of time to kind of talk about kind of dental with kind of the early stages of childhood. And if you stick with me to the end, I'll tell you how to be able to get a free exam, have us take a look at your little one and make sure everything is progressing as it should. So when it comes to kids, there is obviously, if there's no teeth, there's not really a whole early stage. The formula pretty much between 0 to 6 months, because 6 months is when you should be kind of getting the first tooth, which happens to be the typically is usually the bottom front teeth. Between those 0 to 6 months of age, there's really not a whole lot that's really applicable to dental. They're at a very vulnerable stage, and let's be honest, most of you parents who have young children would know that there's really not much that you're wanting to do during that time. That's kind of more of a kind of a survival mode. And so during that time, the child is hopefully learning to sleep overnight, and maybe teething. And once the teeth start coming in, even though they're baby teeth, and I like to call baby teeth practice teeth, there are a couple of things to keep an eye out for. But first, wanted to talk about when is the appropriate time to actually come in and see a dentist. And usually within the first year of life. It is true that there's not a lot that is going to be done. This is kind of my personal philosophy, but there's a lot of kind of fear and kind of anxiety about, especially for a little one, to have somebody, a complete stranger, kind of get really close up and get into your personal space. And a lot of children, depending on what you acclimate them to, they tend to do better. So that's why for me, I say, hey, usually within the first, ages of between 6 to 18 months, it'd be a good idea to have the child come in, kind of have basically a stranger come in and take a peek at the mouth. The child will probably be very shy, but it's something that will help the child to learn that, hey, this other random person over here is not coming here to hurt me. All it wants to do is just take a quick peek, make sure everything is progressing normally. And so you should definitely, you want to have them before the age of 2, when all the baby teeth are supposed to be in, but it could be as early as 6 months. And so there are definitely some things that you'll want to avoid, and really the biggest one is, I think a lot of people are kind of aware of it, it's something called baby bottle rot. And it's when you give a child a bottle and you give them that bottle at night, and it's filled with something other than water. If it's water, it's not that big of a deal, because the water doesn't really, it's really not that bad for your teeth, obviously. But if it's something formula, as the child gets older, milk, breast milk or anything like that, having the child basically have free access to that, really is not going to be overall that great for their teeth, because the teeth are then being constantly bathed in the cow's milk or juice or whatever. This is typically going to be at the ages 12 months plus, so at least a year of age, where the child may want to sleep with a bottle or something like that, and you really don't want to do anything other than water if you are going to be doing this. Now, there is also a lot of evidence where you do want to eventually wean them off from the bottle, because that could also lead to kind of positional problems with the teeth themselves. And what I mean by that is, for instance, if there is a child that is a really bad thumb sucker or tongue thruster, that can actually flare the teeth out to where it will have differences in the way that the jaw is growing. It can lead to skeletal imbalances, that sort of thing, and you can actually change the way that the overall facial structure and the teeth are coming together if you have a child that's constantly sucking the thumb for years on end, or is using a bottle and that's what they use to basically go to bed, because if they're constantly sucking on the that nipple, it puts pressure on the teeth. And so if you are using a giving your child a bottle to as kind of a soothing mechanism at night, you will want to wean that off within the first couple of years of life. And another couple of things to kind of really keep an eye for is how to brush your child's teeth. If you're kids or anything like my kids, they will want some amount of autonomy, and while I definitely encourage kids to be autonomous, everybody, as parents, we all know that while kids may be the best meaning, they may not be the most effective in carrying out particular tasks. So you will have to help the child afterwards to double check and make sure that you've cleaned them efficiently, that you've gotten all the surfaces, especially the biting surface. Children's biting surface tends to be kind of where a lot of cavities will form, and so you'll want to really brush that area really, really well as best as you can. You also want to try to get them to floss. Now, depending on your child, they may fight you on this one in particular, or they may not actually need floss if there's a lot of spacing in between the teeth. But I believe that it's also good to kind of develop that habit to spend that extra 15, 20, 30 seconds to go through and to floss your child's teeth every single day, because if you're anything like my kids, sometimes there's a little bit of spacing in between the teeth where just a bunch of stuff gets stuck inside there, and brushing isn't always the best about getting that stuff out. And so flossing is another thing where you can kind of really get a lot of that gunk and kind of really clean the teeth until they're before bed. And so another thing also to keep in mind is when to use toothpaste. I really think that for the first couple of years of life, you really don't want to be using too many kind of products. And there are some trainer toothpastes, the ones that are safe for a child to swallow. But that's kind of the big thing, is even though fluoride is great, you don't want to be swallowing toothpaste or anything like that. Even the over-the-counter stuff, it's not designed to be swallowed, and so the child really needs to be able to understand to be able to spit out afterwards. And so at a year age, they might end up kind of swallowing everything. So typically, doing water is just fine, and not using any. Using water is just fine, and not to use any toothpaste with fluoride inside of it. But definitely to make it get accustomed, you can use some toothpaste that are like trainer toothpaste that are fluoride free, that sort of thing. And you can just go to the children's section, and they'll be able to have something over there. So now, as far as how to go about brushing, cleaning, flossing, and all that, it is very, very, very similar as an adult. 2 minutes is going to be kind of really ideal. If they start to get antsy after a minute, a minute's better than nothing. Generally 2 times a day. And the other thing as well is you do want to have them try to swish out the water after they eat. Kids love chewy things, and hopefully they don't swish around the juice like my son does. But that is something that should be just have them drink a little bit of water afterwards. Try to get some of that stuff off of their teeth. You do not have to have them sit and brush after every single meal. It's just really kind of at the early ages a little something to try to get them to develop the habits, because the earlier you can develop these habits and make it kind of a fun, kind of incorporate, hey, this is our routine, this is our nighttime routine, this is what we do right after we get up, or after we have breakfast or whatnot, the easier it'll be, and the more accepting that they'll be of that particular habit. Because really the idea is, even though that the kids, even if the kids get cavities inside some of these baby teeth, and yes, it's usually not that big of an issue. They're baby teeth, they're practice teeth, they're going to fall out anyways. Depending on when those teeth have to come out, the kids overall may develop a they may develop some really big cavities inside the teeth, and they can also then subsequently develop a really, really, really big fear of the dentist because, if they go to a dental office, and even if it's a pediatric office, slums that are specially trained to see these kids, there's some kids that they just, they will react very, 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 very poorly, and may need to be sedated, sometimes under a general anesthesia, to actually get some work done. And so the best thing to do is to avoid needing the work in the first place. Obviously, prevention, an ounce of prevention is worth more than a pound of the cure kind of idea. And so that way that the child doesn't really develop these kind of fears, because I see it as I primarily treat adults, but I do see a lot of adults that are like, hey, I had a really bad experience as a child, and that's why I haven't seen the dentist in 5-10 years, and that leads to kind of more and more problems. It leads to kind of more neglect, and it can be a really, really, really big vicious cycle. And I know that every parent out there definitely wants the best for their kid. They want to break the cycle. They, if they had, really bad teeth themselves, that every parent is going to want the best for the child, that for them to have zero cavities and never actually develop a fear of the dentist because they never had anything done. And I believe that kind of really developing these habits at the young ages, the first few years of life, is going to really help contribute to that. So that is it as far as it. It's nice and quick and easy one, but I thought I'd talk a little bit about this because of the relevance with the, the baby formula shortage, and hopefully, those of you parents out there that need are able to get it. The specific formulations, because I know that my wife was really, really, really worried about getting that, and hopefully the shortage itself will also end pretty soon here. So like I said at the very beginning of all this, if you kind of made it all the way to the end, I'll tell you how to basically get a free exam for your child, so we can come and take a look, make sure everything's appearing how it should be, and you can do that just simply by giving us a call. And you can reach us at 503-646-4600. Again, that's 503-646-4600. You can also email us at info at lifebloomdental.com, LAFEBLOOM dental.com, or you can also go to our website, Portland's Dentist, that's PORTLENDS dentist.com, and you can just sign up right there. Make sure you mention the podcast, so we can make sure that we can make the exam free for you. So of course, if you have any questions, feel free to give us a call. We'll be more than happy to answer anything for you. Well, hey, that is it. I hope that you have a wonderful day, and we'll see you.
Thank you for listening to the Dr. Cho Show. If you have any questions for Dr. Cho, you can reach him at www.portlandsdentist.com or by calling his office at 503-646-4600, or feel free to send him an email at info@lifebloomdental.com.